Hi, I'm Brandon, and this is my channel, Siding School. I'm 40 years old, and I've been in the construction trade since I was 15. And I'm a single father with 2 young teenage boys. And this video is my journey with spinal stenosis as of July 29th, 2024. This video is going to be pretty long, so I'm going to go ahead and put chapters in it. So you can skip ahead to something you might want to see, or maybe you can stop at a chapter and save it and then come back to it. But I didn't want to separate it into a bunch of little videos, and because then I'd be spamming my channel with non-siding related content. So what is congenital spinal stenosis? In my opinion, each vertebrae has 2 main parts. It has the front part, the interior part. I think the medical name for it is anterior. Somebody can correct me if I'm wrong on that. That's more circular, and it has the discs sitting in between them. And then there's the back part that has all those bony prominences. The one that you feel when you run your hand down your spine is actually called the spinous process. And all those bony prominences form, or pretty much form, your spinal canal. Your spinal canal is in the middle of it. And somebody with congenital spinal stenosis, that canal formed too narrow from birth. So at 15 years old, I started framing. And I framed for about a year, but my back was so consistently sore that I eventually quit. I went in between framing and siding for the next few years, and then when I was 19 years old, I started my own siding business. I did mostly siding, and I mixed in a few framing jobs here and there, right up until I was 38. And the last one that got me was in 2022. I was working really hard, working long hours. I framed a complex house by myself in about 2 months. And that's when I think I really aggravated my symptoms. So now I'll go on to the symptoms and the pain levels throughout the years. When I was 15 to 16, I'd say it would be like a 6 or a 7 out of 10 for pain. And it was more of just a muscular tightness or soreness. Maybe it burned a little bit. But it was bad enough where I eventually decided to quit framing because I knew that was aggravating it. From 16 to 38, it was, I thought, pretty normal, but my basis of normal could be different than somebody else's. There's a few times when my back went out, I had to get it adjusted, but I thought it felt pretty good throughout those years. At 38, I started framing that house, and my back got progressively more and more sore throughout it. And I managed to get through that, and I started siding. Then there was one morning where I woke up and I just could not stand up straight. And I was just leaning to the right. And that pain was pretty severe. I'd say it was like a 6 or a 7. And that was a muscular pain where you can't bend, you can't lift things up, you can't twist. I was just completely just locked into place at an angle. And the reason why our bodies do that is to protect those nerves, because it knows if you're standing straight, you're going to be compressing those nerves. So it's protecting itself. Well, I didn't like that, so I went to the chiropractor. I went to 2 different chiropractors. I think it took 2 or 3, maybe 4 visits before I got to the right guy, and he got it to release, but then when he released it, I felt tingling at my toes. And I told the doctor that. He said, "That's not good." And that's when the nerve pain started. Since then, it was a constant 5, going up to an 8, and very, very rarely would it be down at like a 2. Most of the time it was probably a 3 if I was laying down, a 5 if I was walking around, and an 8 when I tried to sit in a car or do other certain things. I cannot understate the mental toll that it takes on you when you are in constant pain. That is just, it'll make you feel like you're going mental. I only don't say that it's a 9 or a 10 out of 10 pain because I reserve the 9s for the mothers giving birth, and a 10 out of 10 pain is when you pass out. So an 8 is about the highest I'll say, but I can tell you it was the most painful thing I've ever experienced in my life. Like I alluded to, the only position that was somewhat comfortable was laying down. But the problem with laying down is if I did that and I was at like a 4 or 5 for pain, when I got back up, I'd be at a 7 because those muscles would have relaxed and I would be standing more on those nerves. So doing the dishes was really, really painful. I'd have to hunch down and hold on to the counter. Driving my truck was really painful. I had to grab my steering wheel and pull myself towards it, flex my back. And also like things like fun things to do, like hiking, biking, playing disc golf, all those things I still did sometimes, but a lot of times I just chose to just miss out because I didn't want to deal with the after effects of doing those things. So the timeline of my diagnosis and the treatments was in June of 2023, I went to Shields MRI, and there they made a diagnosis of spinal stenosis, actually moderate to severe spinal stenosis at L4 through S1. And it also said that the rootlets of the quadra equina, if I'm pronouncing that right, filled the thecal sac and are indistinguishable from one another. And what that means is that the spinal cord ends at L3, around L3, and the nerves kind of dump out from there. And mine were so compressed that they were all squeezed together when they should be floating freely. So in August of 2023, I had my first interlaminar cortisone injection, and that brought me a lot of relief both physically and mentally. But unfortunately, the shot only lasted about a month before it completely wore off, and they're supposed to last from 3 to 6 months. So I already knew that that wasn't a road that I was going to be able to use. So yeah, I kind of gave up for quite a while. Finally, in late January, I went to Dr. Adrian Thomas at New Hampshire Neurospine, and I highly recommend both of them. And that was just for my first appointment, and then I went to physical therapy until early March, and that had little to no effect on the pain. So in March, on March 19th, I had another interlaminar cortisone shot, and again, the same results. It wore off in about a month. And then on April 29th, I had a foraminal cortisone shot, and that's when they come in from both the sides and they hit where the nerves come out. And again, that was about the same result as the other one. I didn't notice a notable difference. I did tell Dr. Thomas that I was still having all the symptoms. My leg was still going numb, my knee was still buckling, and he says, well, yeah, that makes sense because you still have spinal stenosis. We didn't make your spinal canal any bigger by doing that. We just calmed the nerves down. I'm paraphrasing what he said though. So finally on June 5th, I went in for surgery. The surgery was a L4 through S1 bilateral laminectomy and decompression. I'm telling you guys, I could not be any happier with the results. The pain is gone. The symptoms down my leg are gone. I feel almost normal. Right now it is July 29th, and I start physical therapy August 2nd to just teach me how to pick things up again and move around and hopefully reduce the risk of injury, and also hopefully reduce the likelihood of needing a fusion in the future, because when they take out your lamina, they destabilize the spine a little bit, so there's a chance that it could start slipping and you could need a fusion in the future. But right now I am happy, I am pain-free, and it is awesome. I will say that I tried a lot of other things throughout the couple of years that I was experiencing this. I tried inversion tables religiously, ibuprofen, acetaminophen, did nothing. It was like eating Skittles. I tried massage. What else did I try? I'm going to look at my list here because I can't remember. Traction, chiropractic. They gave me Flexerol and steroids orally, and I went on that regimen for, I think it was a month, and that didn't, it helped a little bit because it reduced inflammation, but it went away as soon as I stopped taking the pills. The hope was that it would reduce the inflammation to the point where everything will have shrunk back and it wouldn't come back, but it was kind of a long shot anyway, and I really didn't like the way that those things made me feel. I have to add again that I highly recommend Dr. Thomas at New Hampshire Neurospine because he did an awesome job, and I've heard a lot of other stories from other people that went other places and they didn't have a very good result. This specific surgery actually has a 90% success rate, and also it says that if you look it up, it has 75% of the patients are happy with the results. So it is a relatively safe surgery, even though it is spinal surgery. So now we'll get into an explanation of the treatments in order. The first one would be the chiropractic care that I received. It's where they put you sideways on the table and you cross your arms and they twist you and get you to crack. And that did the trick. It got those muscles to release. He also used a massage gun to help loosen the muscles before he did the adjustment. And like I said, it worked. He got me standing up straight, but unfortunately there was an underlying issue that there's no way he would have known about because I had not had an MRI done at that point. So I don't blame him for anything. He did what he was supposed to do, and unfortunately it didn't work out. The next thing that I tried was the steroid and the Flexerol combination schedule. And like I said, I think that went on for a month and with not really much results. And I didn't like the way that those made me feel. The next procedure that I had done was the interlaminar cortisone injection. And for that one, they had me take off my clothes, gown up, and I was able to walk into the OR, and there they have you lay down on the operating table and they wheel an x-ray machine underneath you and they sterilize your back. Then they inject a lidocaine into you as a topical numbing agent. And then from there, they actually inject a dye to contrast the needle for the cortisone shot. And then they put the cortisone shot in you in between your vertebrae at just before it hits the thecal sac, I believe. So, you know, that's pretty good coverage. After the shot, you lay there for a minute or two, and then they wheel things away and they allow you to sit up, and they keep a close eye on you because some people do faint. It's pretty rare, I think. But standing up can be a little risky because it affects your nerves and there's a possibility you could collapse. So they wait a minute and then they help you stand up. They let you take a few steps, and if you're good, then they'll let you go back to your room. As far as the way that the shot felt, it wasn't that bad. Basically, the lidocaine is what you feel, and that's not that bad at all. It's like somebody just poking your back with their finger. And the actual shot can feel kind of strange. It doesn't hurt at all though. And what that is like is basically you feel a little bit of pressure in your back. And when I say pressure, I mean pressure. I'm not a doctor. I don't say pressure for pain. You feel a little bit of pressure in your back. And then basically going down my left leg, it was like if somebody just like gave my leg a firm squeeze. And then basically if you've ever took a 9-volt battery to your tongue, kind of that sensation running up and down my leg a little bit. But that only lasted, I think, while he put the shot in, and then it dissipated really quickly. So I would not be scared to get a interlaminar shot in my back. It's not a big deal for me. I would go do it again today if I had to. The next procedure that I had was a foraminal cortisone injection. And the procedure is pretty much the same for us. You get poked twice, but it feels about the same. And it basically you end up with what looks like 2 little snake bites or something on each side. So you get two bandages instead of 1. But again, the foraminal one is not something I'd be scared of. I'd have either shot again if I had to. So the last procedure I had done was a surgery. And that was a L4 to S1 bilateral laminectomy and decompression. And he actually did a foramotomy, I think. I don't know how to pronounce that word. And that's where they go in from the side and they actually widen out where the nerves dump out of the side of the spinal column. So for this surgery, I had to do a little bit of prep work. They gave me some product called Hybe Cleanse that I was supposed to shower with the day before or the night before, and then the morning of the surgery. The night before the surgery, I think it was like 10 o'clock, they said I could not eat anything, but I could drink water and coffee and apple juice or something. But they said just to be safe, don't have anything. So I did not have anything from late that night until the surgery was over. Then I was able to eat a little while later. For the procedure, they had me go in there. You strip down, put on 2 hospital gowns, you get on the gurney, and they put an IV in the top of my hand right away. And they verified my information a bunch of times. The doctor came in, signed my back, and then he mentioned the procedure that he was going to do to me. And then they have you sign a few things, then they wheel you down the hallway, and they said, we're going to give you something to help you relax. And I remember maybe a minute after that, I was going down the hallway, and I don't remember anything since then. Well, I remember things since then, but not the procedure. During the procedure, they brought me into the room, and they said they transferred me to the OR table. They prepped and draped me, sanitized everything in the usual fashion, verified the signature, verified all the information. Everybody got the tools out, everything got ready, and then they do what's called a surgical timeout, which I think is kind of neat. They re-verify that they have the right person, they re-verify that it's the right procedure, and then anybody who has any apprehension towards the procedure can voice their opinion, and at that point they can actually call the procedure off and say, we're not going to do it right now, we're going to wait. So Everybody stops what they're doing, they verify all that, take a breath, and then they go for it. And they made an incision, maybe about 4 or 5 inches in my back, got down to the bone, opened it up, took off the spinous process of L4 and the lamina, and took off the spinous process L5 and that lamina, got rid of them, went in there and cleaned out the thickened ligaments, and as I already said, performed a foraminal or something, and I think I'm pronouncing that wrong. And I think that was pretty much it. They washed it out with some sterile saline solution. They put a drain tube in to the incision site, closed it back up in layers with the dissolvable stitches. And then on the outside, I don't know, he might have used glue, but he also used what they call steri strips, which just looks like regular tape that they cut into little strips. So he put those on my back. They put a patch on, and then they wheeled me out of there, and they put me in a holding area, and that's where I woke up. The whole procedure took about 2.5 hours, and for me it took 0 time. I was going down the hallway this way, and then I was facing this way, except for there was no end then. I was looking at a whiteboard on the wall, and I could tell there was names on it, and there was nurses sitting there. And I was trying to read the names, but every name was 5 names. It was quite bizarre, and I was wondering why I was waking up from a really, really intense nap. And then I slowly realized that I had already had the procedure done. Then they wheeled me into my room and asked me a whole bunch of questions that I didn't want to answer, because I just wanted everybody to leave me alone. But, you know, you're a little groggy when you're coming out of surgery. From there, I had a vacuum drain with a little squeezy thing with a tube coming out of my back that I had to keep an eye on. At one point, the drain actually did come unplugged, but it was fine because it wasn't like it was going to flow the wrong way. I actually had kind of an argument with a medical assistant about it because it kept just inflating really quickly in 1 minute, not even a minute, probably 15 seconds. He would hook it back up and it would inflate, and I was like, that just doesn't seem right. So eventually I convinced him to get a nurse in there, and the nurse came in and she said, "Oh, fudge," and she went and got somebody else, and it turns out it's fine. It's something that happens, but you need to make sure that that vacuum bag thing isn't just inflating on its own in 15 seconds. So that's one thing you gotta advocate for yourself sometimes. And so about 5 hours after the surgery, I was able to get up and walk around. I actually walked a half a mile, probably 4 or 5 hours after the surgery. And they encourage you to get up every hour and walk for 10 minutes or so. They say it's the best thing you can do for healing is walk around. So I made sure to do that, and I got in miles at the hospital when I was recovering. I was off the medications that they give you. After the first day, I think 14 hours, they try to give you some really rugged medications, and I don't like those kind of medications. So I switched to just acetaminophen, and all the pain that they told me I was going to have from the surgery was actually kind of comical compared to the pain that I was experiencing before the surgery. So I was really grateful for that, but it was just kind of funny to me that they thought I would need those. But, you know, everybody's experience is different, and I don't want to make light of somebody else's experience if they had the same surgery. And, you know, if you have compressed nerves that have been compressed for so long, they're damaged, and that pain's not going to go away right away. Some people, it takes up to a year for the pain to go away. So actually, directly after the surgery, I was really, really woozy. I thought I might throw up, and that was from not eating for so long, and also the meds that they give you when you're under sedation. One thing I forgot to mention is that they put you completely under, they intubate you, they put in a ET tube down your throat, and they inflate a little ball inside your throat to block it off, and they have a machine that's pumping oxygen in and out of your lungs. And the reason why they do that is because the drugs that they give you completely slow your body down, and it also slows down your respiration, so that machine is breathing for you and keeping you alive. Because of that, they also give you what's called an incentive spirometer, and as you're laying in the hospital bed during recovery, it's a little thing. I'm gonna go get it, I'll be right back. So this is the incentive spirometer, and what you do is you breathe into this thing. You don't blow, you breathe in to inflate your lungs, and this little blue thing goes up. And the reason why they do that is so that you don't get, hopefully don't get pneumonia, because the condition that your lungs were in increases the likelihood of fluid buildup. So by using the incentive spirometer, you're fully inflating your lungs and filling in all the little tiny things in your lungs to help clear out any fluids that might have got in there. And they actually encourage you to cough to help expel any fluids that might be stuck in there. So that little bag that collects the fluids, they keep on you while you're in the hospital, and typically, I think when they're able to remove it, when it's not collecting as much fluids, that's when they'll discharge you. They come in a couple times a day and empty that. The whole stay was kind of a little bit uncomfortable and annoying, and there's lots of beeping from the nurse's station. You know, I probably could have requested a room a little further away from the nurse's station so there wasn't so much noise, but the sleep was intermittent, the food's okay, it's a hospital stay, you know, it's not the best thing ever, but overall I'd say it was okay. So like I said, after about 48 hours, they sent me home, and with restrictions, no BLTs, and that would stand for bending, lifting, or twisting. For 6 weeks, you cannot bend over, you can't lift anything any heavier than 10 pounds, and you can't twist. You also cannot submerge yourself, so no swimming or baths. When you take a shower, you have to either cover it with a big sticky adhesive thing to make sure that your wound dressing doesn't get wet, or you can use saran wrap and tape that on there, and you just have to be really careful that you don't get it wet. Now, about 2 to 3 days after I had my surgery, I had a temperature and a headache. And it got so bad that I called places and everybody kept passing the buck. So eventually I just drove up to Elliott in Manchester and had them look at me. I went to the ER. It was on the weekend. And they told me multiple times, don't leave, don't leave. They got me in right away. They were really good. They tested everything. They wanted to make sure that I had no infection and that I didn't have any illness. And yeah, they tested for everything, and everything came back clean. They had put an IV in right away into my arm, just in case they had to give me IV antibiotics because, you know, there's a chance you could go septic when you have an incision at your spinal cord area. So that was a little scare, but I think it was just my body reacting to the trauma that it went through, and plus I did not take it easy on it. I was walking a lot, and I also got off all those heavy meds right away, so that was probably the main reason why. But anyways, I am really, really thankful. I'm so happy that I'm able to move around now. I'm still under some restrictions until I see the physical therapist, but if I had to do it all over again, I would 100% get it done, and I would definitely use the same place. So I'm really happy and really, really thankful. So yeah, that's as far as recovery goes. That 2 to 3 days after I had the little scare, having to go to the ER. Other than that, it's just a matter of no BLTs, so you have to have help. I had friends and family in my church that brought me meals for a couple weeks. That was really, really helpful, and I was really, really happy to have that help. And then with the BLTs, you can't bend over to put on your socks. You also can't wipe, so I recommend a bidet. And my favorite tool was actually the grabber. And it's just a little pincher thing, you know, people use them to pick up trash on the side of the road. And I carried that everywhere with me for about 7 weeks. That was my best friend. I had family and friends helping change the dressings, so you got to get them changed once a day. That was kind of hard to do, to get it changed on time without waiting too long, but that was pretty good. And showering was okay because I was able to just walk into a shower. I didn't have to step over anything. They recommend you buy like a bath chair if you have a bathtub shower combo that you have to step over the rail, but I was able to go up to my parents' house and they have an open shower. And as far as like cleaning and stuff, I have 2 boys that are with me half the time, and they helped with that. My parents also pitched in. Like I said, they live right up my driveway, so that was all really good. They say walk, walk, walk. So I've been walking for 7 weeks now, or almost 8 weeks. Lately, I've actually been able to swim because I made it past the benchmark for the healing. So I think that's good for my back. I'm not sure. I haven't talked to my physical therapist yet. My physical therapy is starting on the 2nd, and from there I'll be able to start picking things up, start bending more, and start twisting. So that's my recovery, and like I said, I'd do it 100 times over. I'm very happy with the results, and I'm excited to see what the future holds. So now I want to go over the plans for my channel, and so you guys know, I'm very thankful for everybody who subscribed, and I want to let you guys know what to expect. So I'm going to try to post a video on the 1st of every month, and also eventually the 15th of every month. And I'm going to focus on more tricks and tips for vinyl siding, but I'm also going to start getting into fiber cement and maybe possibly some wood siding. And there'll be remodel stuff in there for you guys, new construction, and you know, I have a lot of knowledge and I'm excited to share it with you guys. Also, my editing will probably, hopefully, be getting a lot better. I'm learning as I go. That's usually how I do things. I'm kind of the ready, fire, aim guy, and that's what I'm doing here, and I'm pleasantly surprised with all the support that I'm getting. So now I'll close out by talking about the financial impact, and if you don't want to, you just don't stick around because it's kind of a tough story, but I don't really care that much. Obviously, this has had a huge impact on my finances, And my hopes in sharing this is that if somebody else is going through the same thing or something similar, they can maybe use some of the things that I did to help themselves out, to get themselves in better standing. So what I did is I slowed down a lot because of my condition. It was hard for me to work fast, and when you're doing contract labor, it's based on how fast you go. So I wasn't able to make as much money. So I started moving behind further and further, and to the point where eventually I did quit working, and I quit working in about October of last year. So it's been quite some time since I've actually worked. And since then, like, I had credit cards that ran up and went into default. Bill collectors calling me. I just block their numbers. I don't really worry about it too much. That's kind of tough, you know. But once I stopped working, I was able to sign up for SNAP benefits. I was able to sign up for New Hampshire Healthy Families, and I got myself on the plan, and that's how I was able to actually get the surgery done. Without doing that, I don't know if I would have been able to get the surgery done. So I'm very, very thankful for New Hampshire Healthy Families and the SNAP benefits that I've received. And also, my landlord has been really understanding during this time, and I have not paid rent in a long time, probably a year. And so that part is tough. I had to sell my truck. I sold all my tools, and luckily I was able to buy my tools back, or not buy them, but I'm going to make a payment plan on them now so I can get back into siding and then keep creating content. And just so you guys know, YouTube has kept me going for these last couple of years. I don't know what I would have done. You know, making a small amount of money, and the small amount of money I'm making from YouTube, I've been able to pay my electric bill. I've been able to pay for internet because one of my sons uses the internet for his school, so I have to have internet. I was able to pay my cell phone bill, and yeah, I mean, just kept the home fires going. So I'm very, very thankful for everybody who watches my content. Very thankful for YouTube, and keep watching, and there'll be more content coming. So love you guys. Oh, and by the way, I definitely want to make good on all my debts. So the back rent, I'm going to work on paying that back. The credit cards, I'm definitely going to be paying those back. Well, I'll settle on those because they will settle once they send it to a bill collector. And, you know, this isn't the end of the road, guys. You know, things are going to get better from here, and I'm excited to see what the future holds. Maybe I'm a little bit delusional, but I think that my best days are yet to come, and maybe so are yours.